Peter Wishney, Dr. Wishney, 2 offices, Piscataway and Hillsborough, New Jersey. There's 4 other doctors besides me. We have a staff of 20, 22 people.
My name is Dr. Jenny Sanders. We have 1 location. I'm the only physician. We have an MRI tech. We have a nurse practitioner. We have 4 medical assistants that also function as scribes. Thanks to you.
Yeah, I'm Richard Graves. I'm the owner of the practice, and I have 2 other associate doctors. So we have about 10, 11 staff members. 6 of those are medical assistants, and then so far I just have the 1 scribe.
I'm Dr. Daniel Shanahan. I have 1 associate. Her name is Dr. Jennifer Petronella. She's been with me about 8 years now. I've got quite a bit of staff around the office. I'm going to say around 10 or 11 employees between front desk, billing, office manager, and my patient care technicians. And we have 1 scribe who has been probably the best addition to my practice in quite a while. He's been an awesome addition, so I look forward to telling you about that.
I was still able to get my notes done most of the time, on time. It was that I needed to see more patients in a shorter period of time. I knew about you, and we talked about finding a scribe, and I found some great people for me, 2 great people. Came to realization that I can do a lot more if I never touch the computer. I will tell you, it's night and day.
I was always behind on charting, even though I'm computer savvy and we have an electronic medical record and I'm quick on a computer. I consider myself busy. I'll see between 35 to 45 patients a day. My biller was like, okay, you got to get these caught up, that usual thing. Like if my staff would ask, we have another patient we need to fit in today. The first thing that goes through my head is, oh, I got another chart. That means another chart to do. Well, that shouldn't deter me from seeing patients, taking care of my people, and keeping obvious practice revenue going. I started to learn about the scribe thing, but then when I saw the presentation back in March, I was like, okay, it's time to dive in and do the right thing. And all of us were going, oh my God, this was fantastic because the charts were getting done. The staff, my back staff, saw how it was making their life easier. And then in the end, my front desk staff within a couple of weeks was starting to say, this is making things flow easier. So that scribe fit right in there to marry things between me, back staff, front staff, to glue it all together even that much better.
As hard as I tried, I would do good for a while, but eventually I would get behind on my charting, and then I would have to set aside time. I would try to do it in the evenings, but that usually didn't work. Sometimes I'd come in early and try to get caught up. But inevitably I would have to set aside, a few hours on the weekend to get caught up on charts. And I don't have to do that anymore. I'm not trying to rush and do charting in between patients. I'm not dictating in between patients. So, I'm talking to the scribe. Most of the note is already done, and we're just clarifying a few things in between patients. And so that by the end of the day, I'm done.
We all think we can do a lot, but can you do a lot with the same energy and the same vigor, all day long? And when you lose some of that energy, you lose a little bit of that edge that makes you different, makes you the best who you can be. So maybe you see 40, 50 patients, but maybe after 35, you're losing that edge. You're not productive. You just saw the patient, but did you really know what you just did? I will tell you, a scribe having Nikita just gives me more energy. I can just focus one-on-one like this with the patient and move on. Everything is done. Even does my physical therapy prescriptions. So even if you think I'm getting my notes done, I'm getting this done, and everything's great, I will tell you I should have done this a while ago, because just feeling energetic at the end of the day is wow, that's just a game changer.
It certainly reduced my stress level nicely, because I literally leave every day and there's no more charts to do. So that's been a real nice thing. It's actually reinvigorated me to see more patients. So we're fitting more people in. Because we're blessed to be very busy, and the staff engages into that. Obviously, it increases revenue for the practice and efficiency. And it's just made me be able to focus on other things within the practice that need attention, rather than me dreading the fact that my chart box is full still. I don't have that anymore. So it's gone. It's out of here.
And then the other big benefit for my practice is that I'm able to use some of that time to work on other things to do with the business itself. You know, getting more organized, networking, marketing, upgrading the office, things like that normally I wouldn't have had time to even think about.
GSN's kind of detailed guidance on how to do this better really improved my application rate of applicants and the quality of the applicant pool that I was getting. And that was remarkable for me because, you know, in the time of COVID, we were able to hire 3 scribes within 30 days from the minute we posted to the time they actually signed their offer letter. So we had what we needed really quickly, which was terrific.
The nice thing about GSN, of course, is you provided the complete framework on how to acquire one through the ads and all the templates with that. So that made it just point click, stupidly simple, which is great because I don't have time to create content like that. I literally within, I want to say 10 days to 2 weeks, had 19 applicants. I was like, holy cow, this is golden that all these younger people, these young college, pre-med school, pre-PA school kids were doing exactly what you said. They are going to reach out and look to work in a practice type of scenario.
The other thing, you know, as far as using great scribes is it gave me the encouragement knowing that I didn't have to bring somebody in and completely train them because she learned it through your system.
I put an ad Indeed. I don't get this as lucky as you get. and that's the craziest thing because everybody will tell you I consult with a lot of doctors and they have a hard time finding people, but not you. You like, here they are. They've been hiding out behind my bushes waiting for the phone call or something.
Right in your backyard.
The nice thing about the training program, one of the many nice things, is the scribe training and the specialty specific training, and really provided a consistent foundation for all of the new hires so that they were all starting from the same platform and they all had the same foundational information. So I didn't have to do anything to get them up to speed in that regard, which was, I mean, that was unbelievably helpful. And in the dozens and dozens and dozens of scribes and assistants that I've trained in the past, there's, you know, it's just been hit and miss and training on the fly. And this was a very specific, very foundational training program that allowed them to get up to speed very quickly. So that was huge for me.
My suggestion, and I already tell this to everybody, is just do it. Whatever obstacle you see, it's nothing compared to the game-changing effect it has on your practice. It's and on how you feel, and just knowing that those chart notes are done at the end of the day. You almost don't even have to like dictate a note or tell the scribe what to say. They're going to have it down. They're going to know exactly what you want in there.
You know, I was always like worried about the flow of the office, having a scribe and MA, a lot of people in the room. Even if everything's going well in your office, think about having a scribe. It'll make your life a lot easier. Just a lot easier. It's worth everything.
Well, the suggestion is obviously talk to you guys with your company because you provide everything you need. I mean, it's turnkey. That's the key thing. It's a turnkey situation. I didn't have to think. I just had to read, learn, and execute, which for a busy practitioner, that's exactly how it needs to be.
Just do it. There's no, I wouldn't hesitate for even a moment because this will save you time, this will save you money, this will make sure that you're getting the right people to be in your practice. Everything is handled for you and there should just really be no hesitation, and you should, as Nike says, just do it.